Welcome. My name's Bill Howatt. I'm with the Conference Board of Canada, and I'm here to start to have a conversation with you folks around what we're going to call mental health COVID-19. My purpose of doing this, and when I asked to start this conversation, is to be able to provide some insights into some things that some of us may be struggling with. I mean, at 56 years old, I've sat back and I've been reflecting, like many of you, is that realizing that we are in a time now that's different. There's no set of instructions. And one of the most important things I've learned after 30 years of working in the field of mental health is calm. And being calm when you're stressed is not always the easiest thing to do. So, the purpose of this conversation with you will be to start to facilitate some tips and ideas. Some of it will be hard stuff when we'll be talking about things. Maybe it's death, suicide, mental health, stress, tips, ideas of things that can help you prepare. What I want to do is make sure that I'm honest with you. This could be hard, and we're going to be here for the long run. I wish I could tell you that I knew exactly how this was going to work out and that not to be alarmed or be worried. I'm going to tell you right now that to be prudent, to be adherent, to listen to what the officials say for us to do around health. And I'm going to actually kick this off with giving you a few tips and some ideas for you to consider. Because we have a tendency sometimes we hear about things like this and we may not listen. This is kind of like a glacier. It's coming. And when it gets here, when a glacier hits, it's a little bit too late. Many of us are going to be fine, even if we do catch this. My concern is for the older and the vulnerable populations. We have about 15% of our population is over 65 years old. So if you're not worried about yourself, let's worry about the folks that may be not as fortunate as you are by being prudent and ensuring that we're being mindful about how our behavior and our micro decisions can impact other people. This is about standing together as a country and standing up to do what we can to take care of each other in a time that's going to be uncharted and listening. There'll be all kinds of data, all kinds of media, all kinds of posts, all kinds of content. We're hoping to do is create a place that we can take a few minutes each day, sit back, provide some ideas and tips and things for you to think about. And as you start to make your own decisions and getting ready. So I'm going to start with a few things that I've been thinking about. Now, one is get your data from a trusted source. I paused because I was thinking to myself, there is so much data going to come at you. Determine in your head who will be your trusted sources. Your provincial health authorities, uh, the federal government. I know we will be doing at the conference board all our sources. Everything we put on our website will be vetted through our experts. Pay attention, listen to the facts. The next thing I'm going to ask you to suggest is it's time to get prepared if you haven't got prepared. And that means making sure that you pick up. And one of the things some people have been hoarding and all that, most of us have lots of food in our house. Do an inventory of what's in your house. Do an inventory of your cleaning supply. Sit down, create a list, think about it, measure twice, cut once. Think about your community infrastructure, neighbors, resources, how you can kind of work together to support each other if that's possible in regards to providing some inventory for. So be prepared. What people will say is you'll even see what's happened in Italy. Well, there's the Canadians government, I'm sure, will be working on our food supply and all that kind of stuff. So just being diligent, try to build your stores, build those up, and then do your shopping intermittently, safely, following all the protocols that are going to be put in place, and start looking at what type of services you can have that can be delivering, etc. I'm sure we'll be all learning, and what was obvious today may not be tomorrow. Just prepare to start thinking about it's time now to ensure that you're able to hunker down and take care in case you get sick or you're being asked to work remotely and try to stay away from folks. Next thing is hand washing. You're hearing that over and over and over. Wash your hands. The research says you don't need to have the big bacteria, you just need to have soap. Take yourself about 20 seconds and do it correctly. And they're going to talk about it to nauseum, but keep washing your hands and keep your hands away from your eyes, your nose, your mouth, and do the best you can to be mindful of how you're interacting, connecting with people. Social distancing is to look at what you can do to be remitting and reducing your risk the best you can. Next thing, be intentional with your cleaning. Clean your house, clean your space, clean your workspace, be disciplined, just discipline, discipline, discipline. And again, what we're trying to do by all this social distancing and getting people prepared is we're trying to flatten that curve. And you'll hear that is to try to expand, to give more time before, so the medical system doesn't get overwhelmed. So because people are going to get sick, and there's a good chance it's 40, 70% or all of us will catch this, and many of us will be fine. But again, we don't know what the impact's going to be. Some of us will be struggling with financial. Some people will be worried about their jobs. So there's going to be all kinds of social challenges we don't know. But focusing on our mental health will be key. And as I start these conversations around basic readiness, I'll be talking about different tips and tricks that I have, or ideas, I should say, that help people to develop calm. Because the more we can stay calm, the more we'll be able to not overreact and make decisions that could put us at risk. Focus on your health right now. Think about an Olympic athlete, what you put in your mouth. You want to think about building your immune system. You want to ensure that you're paying attention to eat as healthy as you can, making sure you're getting some sleep. Even if you're at home, you could do some push-ups, sit-ups, walk. Try to get some energy. Try to make sure you're following it. And follow your daily routine, structure, get up, keep your schedule, do those types of things, and intermediate and work as you go. And the last thing is that I'm talking about, and I'm doing a series in the Globe and Mail on this, and it's really important to me, is this whole concept around social connections. Now is the time, just because we're going to be doing a lot of this with through video and through conversation, we can leverage technology. It can still be very personal if it's done with technology. With intention, I apologize. If we're doing it with intention and we're being mindful of what we're doing, we can really, really still communicate and interact with people. Use your phone more now. Try to talk more with people. Do Skype, FaceTime. Stay connected with your friends and family and let people know that you're okay. This is the time to ensure that people know that you're okay. So this is a first kind of conversation. I'm just going to be myself. I'm not going to put too much glitz to this. I'm going to have honest conversations because conversations come to me as we have insights, as I start to learn. But my plan is, and my commitment is to be here pretty much every day, every other day. I'll be here as much as I can to deliver a few ideas for us that I believe could be helpful and let you know that I care. And people around us care, and we want to make sure that we're creating this conversation with you. So it's a community to come, have a cup of coffee, listen, maybe get an idea or two or something. And if you have ideas you want us to share, please share them. And check out our new website on COVID-19 that we'll be putting out, and we're going to be doing the best we can to stay in touch. So I'll be around, and I'm not going to say goodbye. I'm just going to say see you in a bit.